Ben, and thank you to all of you for inviting me and for Allen to be here. As Ben said, I'm not Julia. Julia and I, our body of work at NACHO, or the National Association of County and City Health Officials, overlaps a lot, and I live a little bit closer, and she's been traveling, so we decided to switch off this morning. But I'm really excited to be here this morning and talk with you a little bit about what we are now affectionately calling CHAs and CHIPs. So I'll start the morning with a quick quiz about who might know what those stand for. You might already have it in your packet. CHAs and CHIPs. Community health assessments and community health improvement plans. So there you can mark off your first or many learnings for today, I'm sure. But the National Association of County and City Health Officials represents the nation's local health departments, and we see local health departments as a great partner for many of you in your activities in local communities. And local health departments, as one of their core functions, do carry responsibilities for regularly assessing the health of their communities and monitoring that, and putting in place with a broad variety of local public health system partners community health improvement plans aimed at really impacting the public's health, which is the mission of local health departments and what we hope their primary functions are. Although those, of course, are evolving and changing in the context of healthcare reform and the pressures on local and state and national economies. So do look to your local health department for some evolution in their work. I'm here this morning to also talk to you about an exciting new project that NACHO is able to offer local health departments and their community health partners with the generous support of the Robert Wood Johnson Foundation. And it's really bringing together a couple of different things in the context in local communities. And the neat thing is that you're hearing about it today, and the project and funding opportunity actually will be announced Monday. So you're on the cutting edge of getting some new information. With the generous support of the Robert Wood Johnson Foundation, NACHO is going to be launching a new demonstration project by way of grant opportunities for local health departments, but that require local health departments to engage with their community partners in their locality to conduct a community health assessment and develop a community health improvement plan. And through the project, local health departments are required to have their work have three key features, which we think overlap a lot with the work that you all are doing in your communities. The first is that these health departments will be required to engage a broad spectrum of local public health system partners. So planning agencies, parks, philanthropy, education, transportation, schools, in addition to some of their more traditional partners, which of course hospitals, those in the healthcare sector, that type of thing. The second is that the local health department selected for participation in the project will be responsible for addressing the economic and social conditions that play a role or at play as root causes of health in communities, or the social determinants of health as we call them. So this will require the funded sites and their partners to forge new non-traditional partnerships and to pay attention to some of those more upstream factors, again, factors in the economic and social environment that determine health, and not necessarily where efforts have been more traditionally or recently focused, which is on changing health behaviors, trying to get people to quit smoking, as opposed to looking at factors in the environment that might lead to high rates of smoking in a community, for example. And third, that we're going to be requiring the sites to use quality improvement and or quality planning techniques. And this is really with the emphasis of trying to assure that there is a quality focus in all the work the sites are doing as individual partners and together to make use of most efficient and effective use of limited resources in this way. And so with these three key features, we're really hoping that the sites do develop what we're hoping are exemplary community health assessments and community health improvement plans. And so before I turn it over to Allen, I'll just let you know that there are several impeti for this project. One, of course, is that this is a function local health departments and their partners hopefully are doing and engaging in on a regular basis, but we know that's not the case for all. Secondly is this fall, fall 2011, the Public Health Accreditation Board will launch and open its brand new Public Health Department National Accreditation Opportunity. So this is the first accreditation opportunity for public health departments. As prerequisites to applying for accreditation, health departments applying must have a community health assessment, a community health improvement plan, and an agency strategic plan to even apply. And so this project was developed as we learned from local health departments. In fact, many of them do not have recent community health assessments and improvement plans. They are often not receiving direct funding to do this, even though it is in their purview of work. And so this project is really aimed at really helping the local health departments be able to have those accreditation prerequisites as a way of getting as many health departments as are interested and able to apply for accreditation when it opens this fall. We do have six specific approaches to community health assessments or improvement plans, or CHAs and CHIPs, that we are particularly interested in seeing in the cohort of site, which do take into account a lot of the other changes going on for community partners. So I'll briefly go over these, and then I'll turn it over to Allen, and I can take any questions at the end that are more specific to the logistics of the project. But one is that we are especially interested in seeing local health departments that co-lead a community health improvement process with a nonprofit hospital in their community. And the aim of this is to see that the local health department can satisfy the requirements for this project that will position them to fulfill the accreditation prerequisite requirements, and also that will substantially contribute to meeting the non-profit hospitals requirements for community health assessment and community benefit, which I understand, I think that you may have heard a little bit about today, and I'm sure we'll all be hearing even more about as the requirements come out. But this was, of course, in the Affordable Care Act, some more specifics about nonprofit hospitals partnering with public health to do community benefit. And so we're specifically interested in seeing models of that in our project. We're also interested in seeing 2 or more local health departments who have a history of sharing services, knowing that they can best use their resources together. Third model is regional or district health departments, so broad regions or districts that have a single governance local health department. We'd love to see at least one of those in our cohort. We're interested in seeing local health departments who collaborate with tribal communities in their jurisdiction to conduct their CHA and develop their CHIP as well. And lastly, 2 separate models are, we're particularly interested again in promoting partnerships in local communities to do this work. And so the final 2 models that we're particularly interested in seeing, although we anticipate funding lots of others within the cohort, is seeing local health departments who partner with an academic institution or a public health institute, by way of knowing that those partners in particular have certain capacities, experience in health improvement processes, bringing diverse groups together so that they can build their capacity to do this, not dependent on project resources only. So the application opportunity will be released on Monday, April 18th. We'll be promoting it through a wide variety of sources, but you can also go to NACCHO's website for that information. We're funding 12 local health department demonstration sites, and as a follow-up, all the lessons learned and the products produced by those sites, our plan is to put that all in an online resource center so it's available to communities across the nation, even if they're not participating in this particular project. So I'll turn over to Allen.
Great. Well, thank you. And as Lauren has provided you, this is a wonderful project, and actually the Community Indicators Consortium is a participant on this project. We too received a generous grant from the Robert Wood Johnson Foundation, and the primary focus of this is really to support NACCHO's efforts in the area, particularly community indicators, performance measures, and integration, which I've talked about last year and a number of years. As you know or may remember, that the Community Indicators Consortium for, maybe about the last 4 years now has been advocating for the integration of community indicators, quality of life indicators, indicators of well-being in the community, and those program performance measures, services performance measures, and making sure that those are done, indicators are done, performance measures are done, and they're brought closer together. For instance, how does an agency or its programs, how can you show through performance measures their contribution, large, small, medium, to achieving the overall community indicators, or a select or a number of them, so you can actually bring these together. So with this grant, basically there's a couple of things that we're doing. There's an assessment and planning work group that NACCHO has put together, so I actually serve in that assessment and planning work group, which is made up of a whole host of national experts in the area, where we actually have conversations about what should be in these CHAs and CHIPs, and how important are these, and there's a lot of good debate on who should be involved and what does community engagement mean and who should be involved in the community. I've seen some, there's a new wave going on. I'm trying to think of the right terminology, but there's a new wave going on, at least awakening, that when you do these projects, these health projects in communities, it's always nice to have the health experts. They're needed, but you need the community members involved. I mean, I know I'm pretty much speaking to the choir, but if you think about it, if somebody is saying, look, you need to be, these are the things you need to be concerned about health. And you say, well, that's really nice, but I don't really think so. And because, and particularly if you have a national organization or even in the local health department, and without determining what are the community values and community input, and some of these CHAWs and CHIPs that have been done in the past, they get done. And they get put up on the shelf because nobody uses them. Or the health department may use them for a little while, but they get surprised because the community is not involved. In the past, a lot of the community involvement has meant, oh, well, we're going to go survey people, we're going to go have focus groups, but that's it. Their level of commitment, the community's level of commitment, they're not asking a lot for them. And if they're not asking a lot for them from the beginning, they're not going to have a lot of stake in the success of the effort to start with. So they're going to just walk away and not be too concerned. In addition, in the past, there's been a number of times that they would go out and do a community health assessment, and actually they would go out and say, well, let's go grab some data. Let's see what's going on. Okay, then we'll kind of figure up a couple of goals around it, and then we'll do our health assessment, our needs assessment that way, and then we'll move some forward with some programs. And I will say, actually, in 2006, I was involved in that type of situation here in the city of Alexandria. We did that exact same thing, and over the last 3 years, we've started a new process, mobilizing for action through planning and partnership, which is a NACCHO initiative, and part of that happens to be a community health assessment. And when we started going back, we said, yeah, we had some nice things come out of it. We had some work groups created, but it was a one-time snapshot that is stagnant. And we haven't followed through with trend data. We don't know what back in there. So we've been trying to get a little bit of trend data in some instances, but that was a one-time deal. And it's a nice thing now that you can put up on the bookshelf and say, yeah, we actually did that once. Or we didn't really come through there too and say, well, these are the community health improvement plans that we're going to do. When you think about it, it really fits into very well in community indicators aspect, because community health assessments are really assessing to try to develop quality of life indicators and the data underneath it, bringing together the community to focus on what they think are the most important things to measure in the community. When Julia talks about social, economic and social health determinants, what she's talking about, employment, housing, walkability, all things that people are measuring in the community indicators programs. So, and when you think about it, when we develop comprehensive community indicators, we also include health. And we try to look at times about how they interconnect. So really, a lot of people are developing really community health assessments without calling them community health assessments as well. Unfortunately, a lot of times the local health department may or may not be involved.